Have you ever wondered if the insurance premiums that you're paying in retirement, whether at the pension systems or Social Security, are deductible? Today, stay tuned, and I'm going to cover that in the Ohio Pension Playbook. Hi, Todd Gourno here with Three Creeks Capital. I've been working with Ohio public employees for more than 20 years, helping them get to retirement and avoid many of the mistakes that I saw while working for the Ohio pension systems for 7 years. I had a question come in that I want to address for all of you because I hear this a lot. My husband and I retired in May of 2020 at the age of 55 after 32 years of service with STRS Ohio. We kept our health, vision, and dental all with STRS and are having the premiums deducted from our monthly income. Are these premiums deductible? Thanks to the person that asked this question, let's address this. So what we know is your healthcare premiums in retirement are post-tax premiums. Okay, so you're paying those with after-tax dollars. Unlike when you were contributing to the systems, you paid pre-tax. So you're paying with post-tax money for healthcare, okay, premiums. So how does it work? Can you deduct it or not? Well, we have to go through an exercise to determine whether or not this is deductible for you and also how much. So what you need to do first is you need to know what your adjusted gross income is. Adjusted gross income sometimes is referred to as AGI. If you look on line 11 of your 1040, you will see what your adjusted gross income is. Second, you want to take this number, and I'm going to show you an example here in a second, and you want to take 7.5% of your AGI to determine whether or not your healthcare premiums or any out-of-pocket costs are deductible. So let's look at an example. Let's say for today, your AGI on line 11 of your 1040 says $100,000, okay? Now, what we know of that AGI being 7.5% is our calculation here, $7,500. So what does that mean? Let's say that you pay your monthly premiums from one of the Ohio pension systems, your Medicare premium, whatever it may be. Then you have some out of pocket for prescription drugs. You may go to a specialist, have some sort of surgery. So what is deductible is everything after this $7,500. So let's assume for today your cost for the calendar year, this is always per calendar year, let's assume your cost this year for healthcare purposes was $15,000. So in this case, what do we see? Well, we exceeded the 7.5% of AGI, but we know that that is our starting point. That means that everything after the 7,500 is deductible. So really what we want to do is we want to take that 15,000, take off the 7,500, which is 7.5% of our AGI, and that leaves us a deduction of $7,500 for our healthcare premiums. So looking at this question that came in, I would say, yes, your healthcare premiums are deductible from the pension system, from Social Security, in total, only if they exceed 7.5% of your AGI. I hope that gives you more clarity on whether or not you can deduct your healthcare cost in retirement. If you have more questions about this, feel free to reach out to us. We're here to help and get you pointed in the right direction so that you get this right. Thank you and have a great day.